Hi everyone, and welcome to the AI Research Roundup. I'm your host, Alex. Today, we're diving into this post from Google Research titled Loss of Pulse Detection on the Google Pixel Watch 3, published March 20th, 2025. This article details a new feature on the Pixel Watch 3 that can detect loss of pulse. It then automatically contacts emergency services, which has the potential to be truly life-saving, especially in cases of unwitnessed cardiac arrest. The post explains how Google researchers developed and rigorously tested this algorithm. This figure outlines the chain of survival, which is the standard of care for cardiac arrest. Traditionally, timely identification relied on a human witness, represented by the person icon, who could then call 911, allowing for access to CPR, defibrillation, and advanced care. However, this graphic highlights how the Pixel Watch can now perform that initial timely identification, bridging the gap to the 911 call and subsequent life-saving interventions. This figure details the loss of pulse detection algorithm sequence. So, initially, passive algorithms monitor for a pulseless transition. Then, active sensors kick in to rule out false detections. Okay, if a potential loss of pulse is detected, the watch initiates user-facing notifications, first with haptics, then with audio and haptics. If the user remains unresponsive, an emergency call is placed. Importantly, at each stage, the user can de-escalate the process if they are responsive. So, to develop this algorithm effectively, researchers needed data from pulseless events. This figure demonstrates how they achieved this. It compares maximum power during pulselessness, measured in decibels, between two scenarios. The blue dots represent central pulselessness induced in an electrophysiology lab, while the green dots represent peripheral pulselessness induced by arterial occlusion, essentially cutting off blood flow to the wrist. The key takeaway? There's no statistically significant difference between these two conditions, allowing researchers to safely and ethically gather much larger datasets using the arterial occlusion method. So, wrapping up our look at loss of pulse detection on the Pixel Watch 3. Well, this technology really has the potential to revolutionize emergency response for cardiac arrest. The key takeaways? First, the ability to transform an unwitnessed event into a witnessed one has profound implications for survival rates. And second, the rigorous testing and development process, including the clever use of arterial occlusion for data collection, ensures this feature is both effective and safe for widespread use. Okay, thanks for tuning in to the AI Research Roundup, and we'll see you next time.